Okay, we're live. Hello, it's Bill, the knee pain guru with the Comella Foundation, and this is starting our interview series. And today's special guest is Dr. Gianmichael Salvato. We're going to focus and dig in on back pain. All questions on back pain. So we're going to dig into that in just a moment. So in the meantime, check this out. Hello, Dr. Salvato. We are back.
Hey, great to be here. Thanks for having me on.
Welcome. We're going to dig into back pain in just a moment, but I wanted to introduce you. Dr. Gianmichael Salvato is a retired naturopathic practitioner, a research scientist, author, and holistic wellness expert with a passion for helping people eating healthy to live a more vibrant and pain-free lifestyle. Dr. Salvato founded the website mentalwellnessmovement.org. That's mentalwellnessmovement.org, which is among the most respected natural health and wellness websites in the world today. Welcome, Dr. Salvato.
It's great to be here.
Yes. So you knew the topic. We're going to talk about back pain. And today I'd like to pick your brain.
Sure.
Comella Foundation is all about helping athletes and former athletes with chronic pain. So we really want to dig in to understand your perspective on pain, how you understand it, to like what happens with it, and how we can enlighten the people that are watching this video as to how they can begin getting a grasp around it and get themselves out of pain.
Sure. Well, when we talk about pain, we're quite often we think about the physiological pain, but pain itself, whether we're talking about lower back pain or neck pain or athletic injuries, pain relief, that just in general and day-to-day aches and pains, or pain from inflammation. I think it's just great for us to have an opportunity like this to really talk about the fact that there are really three different areas that we have to look at when talking about pain. So again, thanks for having me on.
Mm-hmm. Share with me the three areas. I'm curious.
Well, when I look at pain as a naturopathic physician, as a retired naturopath, I look at three things, and some of them might be more obvious for somebody who's experiencing lower back pain or neck pain or knee pain at any particular moment. Something might be, well, yeah, obviously, this area is what my problem is, but I think we have to really look at the whole body. So we look at physiological imbalances. So physiological imbalances may, in terms of lower back pain, may be from a repetitive stress injury. It might be from an athletic injury that occurred when we were in high school or college or playing professionally. It might also be a physiological imbalance that comes from what we call compensatory issues, where let's say, somebody threw their shoulder off, they tore their rotator cuff, and as a result, they hold their body a specific way. And you would think, okay, so that's going to mean they're going to have pain in their shoulders, they may have pain in their arms, they may have some pain in their neck. But if they're holding their body a certain way, they may end up with lower back pain as well, or knee pain even from that compensation. So when we're talking about compensatory pain, those physiological imbalances, if we really drill down, will often result in chemical imbalances in the body as well. And the best way that I can describe that would be, if you think about for those of us that are, as old as me, we used to have equalizers that were on our stereo systems, and they had all those little knobs, and you could move the knobs up and down. Nowadays, it's all done with electronics and done on your screen. But if one of those knobs was a little out of balance, it threw everything else out of balance. So when we look at the body, inflammation in the body can cause imbalances in the amino acid assay or makeup of your body. Pain can be caused by or cause imbalances in your gut microbiota. It can cause nutritional imbalances if the body's utilizing and running through a particular vitamin, nutrient, or micronutrient in order to try and heal the inflammation itself. That it can cause chemical imbalances. And the biggest chemical imbalance we see with lower back pain and lower back injuries is an increase in cortisol, which is the stress hormone. But cortisol levels, when they remain increased, they may remain elevated, often results in accompanying pain and inflammation. And then the third and final part of the equation is emotional imbalances. So sometimes the pain that we're feeling in lower back pain or neck pain, especially, that could very well manifest in the body as inflammation. It might come from a trauma, and that trauma might be on the athletic field. It might be in another area of life. It could be a car accident. It could be something as simple as falling off your bike and landing the wrong way. Or it could be a purely emotional trauma that resulted in anxiety and tension. And as you all know from the work that you do, we hold those points of tension, those points of trauma in specific areas of our body that are just waiting for us to move to that point where the release becomes possible.
Okay, we had a little bit of a delay with the feed here. I wanted to make sure I got those three down from you. So the first one was a compensation pattern that's going on in the body, some sort of imbalance that's going on. The second one I did not get because
chemical imbalances, biochemical imbalances.
Okay, so the second one was a chemical imbalance, and the third one was an emotional imbalance that I got. Okay.
Right.
When you look at that bigger picture of what's going on in the body, how do you zoom in on the source of pain? So someone has a back injury, back pain, lower back pain, right side, left side, doesn't matter. How do you zoom in to determine what is the source of that pain?
That's a great question. And so what we do in the short term, in the immediate situation, would be to communicate with that patient or that client, find out what it was, when did that pain start? When was that injury? What were the circumstances around that injury? But then in the bigger picture, the zooming in is only critical for the immediate presentation of pain. Over time, as that relationship, that's why I tell people you really can't solve an issue like lower back pain in one visit. And that's because by the time the pain manifests and presents itself and becomes chronic, then all three of those areas, physiological, chemical, and emotional, are likely involved. And so we sort of work out from that moment. So that moment might be a physiological injury on the football field. It might be a chemical imbalance. Somebody got ill, they developed COVID-19, or they had pneumonia, or they had brain surgery. Or it might be an emotional imbalance. They had a trauma in their life and they started to have the lower back pain. We find where that first presentation took place. And then rather than drilling down deeper from there, we actually expand our focus from there so that we're now encompassing the whole person, the whole body, and we're able to create a treatment strategy that treats the entire body.
I love it. This is good stuff. There's a component here in my own working with clients in and around pain. Generally, when you start digging around like that, there's a little bit of a disconnect. Like it's almost like a all levels, whether it's a compensatory pattern, whether it's a chemical imbalance, whether it's an emotional imbalance, there's some level of trauma where the awareness of the person in pain is disconnected from actually when it happened. There's kind of like an ignoring, like the ostrich syndrome. I'll stick my head in the sand for a little bit to like, okay, if I don't pay attention to this, it'll go away. And what ends up happening is over time that builds up. So it almost like a blind spot is developed in the client or in the patient. And now you're like dragging them through the mud to be like, hey, what happened at the time this happened?
Exactly. You just froze up, but while you're screen there, you're back. Go ahead. Were you going to ask a specific question, or I was going to jump in with some thoughts about that?
It was around that gap. Like that's really a huge piece in pain is how can we narrow the gap to bring the client or patient in alignment with when that experience first started happening? Because a lot of times they blocked it out for a while.
Right. Well, here's what I do, and this is certainly not the only approach. There are other practitioners I've talked to who use different approaches, but specifically around lower back pain, this seems to be an area that we see that as you know from your practice, we see that very often. So what I like to do to take that client out of that tendency to want to push back and that fear that they have, because fear again will trigger inflammation, will trigger pain. So what I say is, hey, do I have your permission to tell you a little story and see if this makes some sense? And the client is always going to give you that permission. And I say, imagine if you would that there's this guy Tom, and Tom is a college athlete and a fantastic football player. Now, I probably shouldn't use that example of a football player since I don't know the first thing about football. So for all of the football fans out there, please excuse me. But let's say Tom was an amazing quarterback. And right before the big game, Tom's girlfriend dumps him. Now, Tom has just gone through an emotional trauma. Tom is as a result of the emotional trauma, he's probably had some chemical imbalances taking place. He's stressed, he's tired, he's maybe been crying or angry or he's processing emotions. That changes the chemistry in the brain, which then changes the chemistry in his gut. So no matter what Tom ate that day, no matter how hard he worked out that day, no matter how prepared he was to play the game, he really couldn't have his head in the game. He was distracted. As a result of that distraction, he was maybe moving with a little bit more tension, and that tension in his body set the stage perfectly for when he fell, when he went down, he caused a lower back injury, or he caused a knee injury or a neck injury. And so I'll ask that client, does it make sense to you that the best way to understand how we can help Tom long term is to look at all three of those causes? What was the emotional trauma, because he doesn't want that trauma to happen again, that injury to happen again. He wants to release the immediate pain, but he also wants to learn how to begin to help the body return to what we call homeostasis or balance. And so if you just treat the immediate cause of the pain, that he fell and twisted his back, fell the wrong way, you're going to maybe give him some immediate relief, but the experience of the breakup is going to return. That's going to return the tension. The tension is going to be holding on to that point of trauma when he had the injury, as well as the point of trauma of the breakup, and that's going to trigger those chemical imbalances again. So when you take that client out of the equation and say, does it make sense if we were going to help Tom long term? We need to be able to treat all three of those areas. The client says yes. And then I say, now do I have permission to go deep with you? And they say, yeah, sure. and you say, wouldn't it make sense in your situation if we, rather than just put a Band-Aid on this pain and get you some temporary relief, if we could work on a strategy that gets you immediate relief, but actually make sure that this doesn't come back up again.
Mm-hmm.
And now the resistance has softened, because now that person sees, they're not looking at themselves as, hey, I didn't come to you because I want somebody to help me relieve emotional pain. I'd rather bury the emotional pain. I just want the physical pain to go away. And you and I know that in most cases, that means the physical pain is going to come back again and again and again.
I could attest to that. Yeah, well, it was the physical injury of the knee for me. Physical injury of the knee, and of course, surgery, did the physical therapy, had the big titanium DonJoy knee brace. Big titanium DonJoy knee brace, and on the other side of all that, I still had the same pattern going on in my body. And no matter how hard I exercised, and it was a physical imbalance that was going on for me, along with chemical and emotional as well, of course.
Sure.
Looking back in hindsight, so there was this thing, in order for me to get back to feeling normal again, it wasn't going to happen as me doubling down on what I already knew. I had to create different patterns, go deeper than just the surface level of making sure the left leg was as strong as the right leg.
Exactly.
So what we're going to do right now, this is wonderful stuff. I want to take a short break to share with people some more information about the Comella Foundation. We'll be right back. Okay, we're back.
That was great.
It turned out pretty good. Okay. Are there other things that are coming to your mind as we're talking that you've run into with patients where they get stuck in trying to eliminate pain?
Yeah, I think that, again, on a person-to-person basis, each one of us has, one or more of those three areas that we don't want to deal with. It might be that the physical cause of the lower back pain is what somebody might not want to deal with. What the physical cause is, maybe they're overweight, maybe they're getting too old to keep playing rugby, with the level of regression, but they don't want to lose the physical activity, or maybe it's the chemical imbalance. They don't want to deal with the fact that when they get stressed, they don't make the right food choices, or when they get stressed, they get knots in their stomach, and they're not ready. They're not willing to ameliorate the stress causes. So you've got emotional and chemical going on there that's going to affect them when they go to play tennis, or they go to play baseball, or they're doing some kind of physical activity. And let's face it, we're not just talking about athletes. We're talking about athletes and former athletes and just fitness enthusiasts, all of whom might have one or more of these areas that it's uncomfortable to deal with the cause of our problems. So we have a choice, and the choice is either we then have to live with the pain, and that just deprives us of really living fully, being able to be really present to whatever that activity is we're doing. It also deprives us of so much of the balance in other areas of our lives, because lower back injuries don't just bother us when we're on the playing field. They bother us when we're sitting watching television, or when we're taking a walk, or when we're getting up out of bed in the morning. And so the real question, and the question that I think is one of the reasons why I was so happy to come on the program tonight, is that What you're doing with the Comella Foundation, from my perspective, is bringing together this amazing brain trust of folks who approach pain relief and sports fitness and peak performance from different areas, so that the person who has lower back pain doesn't just get the perspective of, okay, so there's the naturopath, he's going to look at physiological, chemical, and emotional imbalances, but they get the person like yourself to help them with learning how to move more effectively and efficiently to release that pain. They get the massage therapist, they get the yoga practitioner, they get the weight trainer, so that each one of us brings that little bit of expertise and wisdom to the table. And then that person, based on wherever they are right there in that moment, gets to make a decision on how they want to proceed. If they're a little uncomfortable dealing with the emotional trauma right here and right now, they can at least work on some strategies with you on how to move in a way that releases that trauma, releases the cause of that trauma and that tension. And then, as you and I know, almost by magic, we release the source of that trauma, and now that emotional thing we were trying to run away from isn't such a big deal anymore, and we can let it go.
Right. Now, I agree with everything you said, and I'd like to pick your brain about when working with a client with pain. One of the biggest challenges I've found is the mental state that has been adopted when they're in pain. And it almost creates like this hindrance, like getting someone out of pain. Like the physical part is almost the easy piece. It's the mental pain around the belief of breaking it down into bite-sized chunks, things that they're able to do and empower themselves, and at the same time not fall back into the old mentality that got them into the pain to begin with. Like, how do you approach that piece? Because I find that that will take a person, athlete, fitness enthusiast, whoever that is, that will take them out in an instant. They've experienced the results, and then they go back into that old mindset. They get right back into pain, and they're like, it doesn't work. I've just got to accept it. That's the way it is.
Right. That's another really terrific question, because it is something that we see really frequently. And the strategy that I use personally to help folks overcome that is to teach them, and there are a number of different ways you can do this, but I'm going to use a somewhat humorous example today that I just recently used with somebody, and it's to do what we call creating a state change. Because it's like you said, quite often we could teach them the strategy to release the point of tension, the point of pain. But if the mental piece isn't addressed, it's easy to make that pain my pain. So we first off teach them, stop owning the pain. The pain's not yours.
Right.
The pain it's not part of who you are. It's not part of what you are. And so stop making it my pain. And know that your injury happened in the past, so it's not even your injury anymore, because that's gone. And whenever you start to feel like there's just nothing I'm going to be able to do to keep this pain away. There's nothing I'm going to be able to do, every couple of days it comes back. So I say I know it's uncomfortable to revisit why you keep manifesting the same pain. And I know you don't want to, have somebody sit here when you're coming to me for help with your pain saying, let's dig to where the pain first started and let's look at what was happening. And you don't want to do the emotional work right now. I get it. But here's what I want you to do. I want you to take a picture, a selfie of you with your finger up your nose or some other absurd, crazy thing.
Okay.
And every time you catch yourself thinking those thoughts that are really detrimental, that are harmful and crazy, I want you to open up that selfie. Whenever the pain's getting too much, open up the picture of you with your finger up your nose. What that does psychologically is it causes the state change. We can't pity ourselves and laugh at ourselves at the same time. And there are other ways for people who don't want to do something that absurd. It could be a piece of music, And so what I'll try to do is anchor that person when they're using movement, for example, to alleviate the point of pain. Play a specific piece of music that they absolutely love. And so for some people, we'll have them do some different stretches or movement, or just kind of find that place of relief when they're in the shower. And I'll say, play some music while you're taking that shower that relaxes you, that you really love, a piece that you particularly love. And whenever you find yourself going in the direction of the pain again, listen to that music, because now we're anchoring the experience of release to something that they love. And sooner or later, we break that pattern, because I think you said it. These things that keep bringing up the pain are not happenstance. It's a pattern, and patterns take time to break. But over a period of 21, 30, 45 days, you can break that pattern, but you have to replace it with something better. If you had a house that had a broken down, a rickety table, and a chair that had three good legs and one short leg, you could take that table and chairs and put them out by the curb. But when dinner time comes, if you haven't brought a new table and chairs in to eat at, you're going to go and bring the table back in just for one more night. And before you know it, it's 3 months down the road and you still have the same, ratchet table sitting in your kitchen.
Right. Yeah, I agree. It's a neurological pattern that's been established in the body, in the mind, and in the body. We need to change that. We need to rewire it, and we need to do it systematically in a way that supports the process, so their neurology doesn't snap back like a rubber band to what it was doing before they walked in to
Right
get
on.
or logged on to the ComellaFoundation.org website to get some help.
You got it.
Dr. Salvato, I want to thank you very much for being here. Is there anything else you want to punctuate your the call today with?
Well, as the guest on the show, I guess it's probably not normal for me to want to do, but I just have to say that having had the privilege of working with you and so many of the other practitioners that are part of the work that you're doing, if you suffer from lower back pain or neck pain, athletic injuries, knee pain, or chronic inflammation, I absolutely, with every fiber of my being, and as a professional, as a wellness professional, medical professional, I wouldn't make this recommendation lightly. The address you see on the bottom of your screen for the Comella Foundation Next Steps would be what I would punctuate more than anything here, because you just said it. We need to create a shift in the body and in the neurological wiring, so that experience changes, and it needs to be systematic. And you've done a fantastic job of bringing together that system. So there's my instead of I guess most people come on a show and they plug themselves and their new book and their TV show, whatever. I just got to say, this opportunity is too important for folks who are suffering from pain, that I'm going to plug what you're doing right now.
Great. Well, Dr. Salvato, I know you have some wonderful blog posts on the Comella Foundation website. We also have some great information as far as videos and some other trainings from yoga practitioners on lower back pain, as well as the content that you have provided on the ComellaFoundation.org website. The website is below on the screen, so you can see that. Dr. Salvato, thank you so much for being here.
Thanks for having me.
And appreciate it. And we will be talking to you soon.
Take care.
Bye-bye.